Welcome. Today's presentation is Optimizing Your Technology. My name is Lisa Tonkinson. I am a principal with Patient Craft, and I'm here with Chris Wiekert. Chris is the Senior Product Manager at Infor, and we're going to be discussing some information today that's valuable in supply chain, specifically for those of you who are undergoing some changes with your technology, maybe implementing a new EMR or EHR. So we really want you to stay tuned for the importance of how this can affect you and what you can do to help solve some of those problems and make your implementation a little less painful. So with that, I'm going to get started. I'm going to start talking a little bit about whether or not this is a new implementation and what you really need to ask yourself prior to the implementation. These questions may seem a little bit simplistic, but if you don't ask yourself these questions at the beginning of the implementation process, you may have some difficulties throughout the presentation. So Chris, let's talk about that. How many facilities are involved? That's usually the first place where I get started. Do you have outside clinics involved, physician practices, and how will that impact the process going forward with the new technology that you're implementing?
Yeah, and those are a lot of good questions because each of those will help determine the scope and the size of the resources that are going to be needed to really accomplish your goals and reaching your objectives through your technology use.
Now, an item master standardization is often required when you're implementing the new technology. Even though that it seems like it's solely supply chain, there's some other questions that are involved with that from a corporate level or a facility level that you need to discuss. I know myself personally, I always ask, is there a corporate standardization involved if, like in the beginning, if you have more than one facility, or are there multiple item master files you're going to be merging together? Have you experienced that in your
One thing you really learn, especially through AHRMM, is there's so much data that can be gathered from a properly designed item master. And there's so much, and it's very important to really understand how are you going to do that and what differences are going to come from this new implementation. Are you going to change your standard? Are you going to change what information goes in? Are you going to erase your data or start over again? So it's a really important step that a lot of people are starting to come to realize.
Right.
How do we manage that item master? And it really kind of drives the scope of the project as well.
And you just led me right into my next conversation point. What is the project scope? As you said, it does drive where the scope is going. And I find, interestingly enough, that often that's not discussed at the beginning, especially when it's an EMR and EHR implementation. We don't think to get supply chain involved. We don't ask whether we're going to do a full cleanse or use the existing item master file. And we often don't even think to consider the fact that CDM synchronization, your charge description master, is going to be party to this.
Exactly.
We're supply chain folks.
Yep.
And what is charge master?
Yep. And like I said, this is a big part, and really managing that amount of work and resources, it's going to be important to really discuss up front and have a good understanding.
So let's talk about a little bit about the role of supply chain folks. Who are they? What are they going to be? What's their participation in this type of project? Often I find that they're not the project leader. Sometimes I think they should be, but often they're really either an active participant or maybe a consulted player or sometimes even an informed observer. I think the informed observer role can lead us to some challenges because a lot of what is going on, as you said, relating back to the item master and the cleanse, really is in their wheelhouse. Have you experienced that?
Yeah, every time we've done an implementation or been part of one, that's always a huge discussion. And we want to get the right people in the right seats at the beginning of the program, because in a lot of cases, supply chain is a department that's last added to the project plan. And it's really kind of difficult to get to that point where we are one of the first because we touch so many pieces of that project overall.
Well, I agree with you. We are often the last ones consulted and sometimes one of the most important players. So let's talk a little bit about what the differences and challenges are going to be when we actually get brought into the project or the implementation, and how we can anticipate our technology differences and challenges in advance so that we're well prepared. First, I often say if this is new software, you need to anticipate that you're going to have a new learning curve. No one's going to know how to run the new software, even if you've used it in another facility. There's going to be some nuances that are different based on your setup. I think the other question that I'm used to asking is, what are the objectives from an administrative standpoint? They often differ than what the the overall project implementation are. Are we going to standardize the systems? Are we going to do product standardization, for example, vendor standardization, description matching? And at what level are we going to do it? At the facility level? Is corporate driving this? Physician preference items, are we going to be talking about those?
And one of those things with the new implementation, it really kind of gives you that opportunity to take a look at all those gaps and address those with one big solution.
Great. Well, let's talk about what this new role is. When supply chain gets involved, do they really understand, or can they define what their role in the implementation is going to be? And how is it going to affect them and the technology they're using? Are there resource considerations, time considerations? I think that's probably one of the biggest challenges in any implementation, whether it's EMR, supply chain, or just a new software application. Have you experienced any difficulties with getting resources, balancing the resources involved?
Absolutely. In the healthcare market today, one of the biggest challenges is maintaining your current resource level. I think a lot of organizations are going through resource decreases, and what that does, it makes a negative impact on being successful through these changes. Because with less resources, you can really, while you're trying to maintain your current operations, how are you going to do that? And with the projects that keep getting added within supply chain, it's always been a challenge to stay on top of what you need to do on an operational day-to-day basis.
I think myself personally, one of my biggest challenges has also been a return on investment, the ROI assessment. I often find that that's not something that's discussed at the front of the implementation when you're bringing in new technology, but then it comes around full circle at the back end when you're expected to produce information. So I personally always like to encourage the folks that I'm working with to start tracking and trending any opportunities at the beginning.
But a lot with those ROIs, you got to look at the distance down the road too, and how it's going to impact you, and how is the environment changing, and is this going to help your operations in a later date?
Well, I think we've talked a lot about the new implementation. Why don't I let you transition now to whether or not this is an integration rather than a new implementation?